Hello students, welcome back to the channel. In this video, we are going to study about the structure and functions of blood vessels. And mainly in this video, my main focus will be to explain you the arteries. Okay, two types of arteries are there, elastic artery and muscular arteries. We'll be focusing on the mean arterial blood pressure, systolic blood pressure, diastolic pressure, as well as pulse pressure. So main focus will be on the arteries in this video. Now see carefully, there are 5 main types of blood vessels are there. Arteries, which will divide to form arterioles, which will again divide to form capillaries, which will unite to form venules and vein. So you can see this is artery. Now two types of arteries are there. One is elastic artery, another is your muscular artery. Clear? Then artery will divide to form arterioles at the organ level. Once the artery is entering into the organ, it will divide as an arterioles, which will again divide, you can see in the diagram, to form capillaries. Capillaries are uniting to form venules, and venules will become into the medium-sized vein or finally into the large vein. And if you see in the diagram, you will find that this is the green color key is there. If you see endothelium, endothelium is present in all, and basement membrane. These two layers are present in all. If you check carefully, you will find endothelium and basement membrane is present in all. Now, if you see elastic connective tissue and smooth muscles, you focus on these two diagrams, you will find they are present in arteries and veins, artery, vein, and as well as in venules, but they are not present in capillaries. So these are the layers which are absent in the capillaries. And outermost layer, if you see, fibrous connective tissue is also absent in capillaries. Now, if you focus the diagram, from the diagram you can understand, in muscular artery, smooth muscles is more. See the red color, smooth muscle is more. But in case of elastic artery, you can see elastic fiber is more, blue color. Okay, beta? That is why the name is elastic artery, because here elastic connective tissue is more. It is muscular artery because it is here the muscles are more. And if you see in the arterioles, check in the arterioles, you are not having elastic connective tissue. As well as in venules also, you will not have elastic connective tissue. Clear? But again, if you see in the medium-sized vein, you are finding it is having as well as in the large vein, but it is very, very less. Connective tissue, elastic connective tissue is very, very thin if you check it. So first of all, if you see, these are the 5 main blood vessels. And now if you see the layers of the blood vessel is, first is your tunica externa, which consists of elastic fiber and collagen fiber. Then is tunica media, which is muscular, which consists of the smooth muscles as well as connective tissue. And intima is interna, or intima is the one which consists of endothelium. Clear? What we studied the layer, now here they have given as a name only. Now, what is the role of these layers? Why they are present and what function will be performed by the layers of the blood vessels? See carefully. All blood vessels contain an inner layer of epithelium cells called endothelium. All are having, whether artery, arterioles, capillary, venules, or vein, which is continuous with the endocardial lining of heart. So they are present. Surrounding the endothelium, it is a extracellular material called basement membrane. So this is common. What is common? Endothelial is common for all blood vessels and basement membrane is common. Now focus the line carefully. With the exception of capillaries, capillaries will not have. Remaining all, leave the capillary, but all blood vessel will contain smooth muscles and connective tissue which surrounds the basement membrane. Though thickness may vary, we have already seen these layers will vary in thickness in different types of blood vessels. You know very well what is the role of the smooth muscles? Any idea? Smooth muscles are the one which can contract and relax. As a result, they are making the lumen narrow or they can make the lumen wide. So smooth muscles are the one which will regulate the diameter of the lumen. If you see carefully, there is sympathetic nerve fiber, sympathetic fiber of autonomic nervous system. When the sympathetic fiber of autonomic nervous system is sending the muscles, sending the nerves to the smooth muscles, if increase is there in the sympathetic fiber, what will happen? It will make the smooth muscles to contract. If it is contracting, means lumen is becoming narrow. And decrease in the diameter is actually, it is known as vasoconstriction. We call this process as vasoconstriction. So if the sympathetic fiber increases, stimulus is increased from the sympathetic fiber, it leads to vasoconstriction. But if suppose the message decrease, if sympathetic stimulation decreases, what will happen? The lumen will increase and we say process vasodilation is done. So vasodilation as well as vasoconstriction, which is the work of the smooth muscles. It is under the influence of the nervous system, and vasodilation is also under the influence of certain chemicals like nitric oxide, hydrogen ions, and lactic acid. But it is also observed that some smooth muscles of the cardiac, they are of most blood vessels are partially contracted all the time. Okay, and this state of partial contraction is known as vascular tone. So the rate of blood flow through different part of the body is regulated by the smooth muscles. Okay, and the extent of the contraction is naturally, this is the way how they are regulating the blood pressure. The smooth muscles are responsible for vasodilation and vasoconstriction. Now, two types of connective tissues which we studied. One is elastic connective tissue, another is your fibrous connective tissue. The two types of connective tissues are there. One is your elastic connective tissue, okay? Another is your fibrous connective tissue. Elastic connective tissue will contain elastic fiber, which allow the blood vessel to stretch when the heart is pumping the blood into the vessels. So it allows the blood vessel to stretch in response to incoming blood and then return back to their original shape also. Means recoiling power is there. Fibrous connective tissue, which contain mainly collagen fiber, it is the one which is providing the tensile strength so that they can tolerate the pressure and without bursting. And we have already seen in the diagram that blood vessels will vary with respect to the amount of elastic as well as fibrous connective tissue they contain. Now see, we are focusing on arteries. I told you in this video, my main focus will be on the arteries. So arteries are the one which carry blood away from the heart. They are specialized because they are responsible for rapid movement of the blood from the heart to the organ. And because of their large radius is there, they offer very little resistance to the blood. But arteries work as pressure reservoir. They are working as pressure reservoir so that the blood flow should be maintained continuously even though the heart is relaxing. I told you there are two types of arteries. Elastic arteries because they are rich in the elastic fiber, and muscular arteries because they are rich in the smooth muscles. Now you can see in this diagram, this is your heart. Let us assume this is the heart. Okay, when the heart is pumping the blood, see the diagram carefully. When the heart is pumping the blood is going into the arterioles and finally to the capillaries. But whatever pump is done, means stroke volume, it is 70 ml. It is not going at the same amount, is not going same. Some is, if you see, it is stored here. Some is stored here. And this is property because of the elastic fiber. Elastic fibers are responsible for stretch property. They are helping to make the blood vessels to dilate. And when the heart is relaxing, it is not pumping the blood. That time, see, still the pressure is there in the artery. Pressure has not fall to the zero. How, why it is not fall to the zero? Because if you see the elastic fibers, they are recoiling back. So blood is pushed again into the artery so that flow should be maintained. So because of the elastic fiber, arteries normally have high compliances. Now, what is compliances? Compliances means an ability to stretch. For this, you can imagine, suppose one balloon is there where very little pressure, it is inflating very easily. So you will see it has got high compliances. And if suppose your wall is very thick, sometimes you must have felt also, wall is thick and you're putting, you are blowing, but that the amount, the expansion is not that much going on. Why? Because compliance is less. So we say compliance is the one which is responsible for stretching. So arteries are having high compliance means their wall is able to stretch easily without tearing in response to only small increase in pressure. You are increasing very less pressure, you are putting little pressure through the mouth, you are blowing the air, and expansion is more. We will say it is having high compliances there. Now, these arteries, they contain large amount of elastic fibers. They are known as elastic arteries. Because of this reason, we say generally, elastic arteries will be near to the heart only. So they are the two major trunks which exit the heart. That is your pulmonary trunk and aorta. And if you see aorta and pulmonary trunk, they are the largest elastic artery with a diameter of 2.5 centimeter. Other arteries elastic are there. For example, you can see brachiocephalic, subclavian, common carotid, common iliac arteries, but their diameter is only 1 centimeter. What is a function elastic artery will perform? I told you they are working as pressure reservoir. And they are responsible to maintain the flow. They are maintaining the driving force for the blood flow while the ventricles are relaxing. When the heart is contracting, ventricles are pushing the blood into the arteries. So blood is ejected from the heart into the elastic artery during systole, and their high elastic wall will stretch because so much blood volume is coming. I told you stroke volume. As the wall stretch, they store some of the pressure generated by the contraction of the ventricles. So they are storing some of the blood, they are storing there. When the ventricles are relaxing during the diastole, wall of elastic artery recoil, it come back because the stored pressure is now released. Now it is released. And that is why, though the heart is relaxing, diastole is there, in the ventricle pressure has gone very low, but still in the artery pressure is not low. Elastic recoil will propel the blood onward, ensuring that the blood continues to move through the remaining arteries, even though the ventricle is relaxing and is not ejecting the blood. Now, elastic arteries, I told you it will be the one which is near to the heart. Means away from the heart, then will be the muscular artery. So, elastic arteries will conduct blood from the heart to the medium-sized arteries, and these arteries will contain more smooth muscles and less elastic fibers. That is why they are known as muscular arteries. Muscular arteries are the one which are capable of doing vasoconstriction because muscle is there. And most of the arteries in the circuits are generally, you can say in the arterial, whatever we study in the entire blood, this thing, circulation, when we study properly how many blood arteries are there, we find major are muscular arteries only. And their diameter can be from 0.5 millimeter to 1 centimeter, also it can be more. Muscular artery will distribute blood to the organs, and when it enters the organ, it will branch into the arterioles. So I hope so this much topic is very easy for you. Now see arterial blood pressure. I told you when the ventricle is contracting, the pressure with which they are forcing the blood into the artery, that pressure is known as systolic pressure. The maximum arterial pressure reached during peak ventricular ejection, that is known as systolic pressure. And diastolic pressure means it occurs just before ventricle ejection begins. okay, before ventricle ejection begins, means end of the diastole. That is known as diastolic pressure. The arterial pressure is recorded when you are recording the arterial pressure. You recorded first systolic and then diastolic, the 120/80. Clear? The systolic pressure and diastolic pressure, and what is arterial blood pressure. This much is clear. Now, what is pulse pressure? Pulse pressure is nothing. Formula is systolic minus diastolic. Systolic minus diastolic. Okay, so it is a difference between systolic and diastolic pressure. So value comes to be 40 mmHg if you are assuming 120/40. Clear? Last is your mean arterial pressure. Mean arterial pressure is the average blood pressure in the arteries. It is the average blood pressure in the arteries. In this diagram, you can see this is your systolic pressure. Check the diagram better. Please check it carefully. This is your systolic pressure, 120. This is your diastolic pressure, 80. Okay. Difference is pulse pressure, you can see. And if you see mean pressure is actually, we say it is an average blood pressure, but see the value is shifted more towards the diastolic side, not towards the systolic side. Why? Because the diastole lasts for longer time. That is why it is actually shifted towards the diastolic side. Now formula, how to calculate it? This is the formula I was given to you. Diastolic pressure plus 1/3 of the pulse pressure. If suppose here we say the diastolic pressure is 80 and 1/3 pulse pressure is 40, 1/3 it is coming out to be 93. So arteries offer very little resistance, so they pressure, only a negligible amount of pressure energy is lost. So therefore arterial pressure, which arterial pressure, that is systolic, diastolic or pulse pressure, these three are your arterial pressures, okay? They will, as well as your mean arterial pressure, these all four, systolic, diastolic, pulse or mean, they will be same throughout the arterial tree. So I think so arterial blood pressure, systolic, diastolic, pulse pressure and mean arterial pressure. I hope so this video will be helpful for you to learn all the numerical questions related to this topic. And why we say arterial pressure is important, because that is the elastic fiber is responsible to make the go for the stretching when the ventricles are contracting, and though the ventricles are relaxing, but then also pressure is there in the artery because elastic fiber helps the arteries to recoil back. So I hope so this video might be useful for you. Thanks for watching.